Hello, my name's Lauren, and I'm an undergraduate from ISU studying exercise science. And today I'll be interviewing my grandma Joyce. You are being invited to participate in the PE 483 class project. Your participation is completely voluntary. For the project, I will need to have you answer questions surrounding your health and current lifestyle. With your permission, I will videotape the interview process. If you agree to being videotaped but feel uncomfortable or change your mind for any reason during the interview, I can turn off the recorder at your request. The video will be shared with my professor and may be used in PE 483 for any educational purposes. Okay. First, I'm going to start out by asking you some general health questions. This is called a PARQ, also known as the Physical Activity Readiness Questionnaire. It's just yes or no questions. Has your doctor ever said that you have a heart condition?
Yes.
Have you ever been diagnosed with high blood pressure?
Yes.
Okay. Do you feel pain in your chest at rest during your daily activities of living or when you do physical activity?
No.
Do you lose balance because of dizziness or have you lost consciousness in the last 12 months?
No.
Have you ever been diagnosed with another chronic medical condition other than heart disease or high blood pressure?
No.
Are you currently taking prescribed medications for your medical condition?
Yes.
Do you currently have or have had within the past 12 months a bone, joint, or soft tissue problem that could be made worse when becoming more physically active?
Yes.
Has your doctor ever said that you should only do medically supervised physical activity?
No.
Okay. And since you answered yes to one or more of the questions above, we have to move on to pages 2 and 3. Do you have arthritis, osteoporosis, or back problems?
No.
Do you currently have cancer of any kind?
No.
Do you have a heart or cardiovascular condition,
Yes.
such as an abnormality of your heart rhythm? You said yes.
Yeah, kinda.
Okay. Do you have difficulty controlling your condition with medications or any physician-prescribed therapies you're taking medications for, right? Okay. Do you have an irregular heartbeat that requires medical management?
No.
Do you have an irregular, or do you have chronic heart failure?
No.
Have you been diagnosed with coronary artery disease?
No.
Do you have high blood pressure?
No.
You have been diagnosed with high blood pressure, right?
Yes.
Yes. Do you have a resting blood pressure equal to or greater than 160 with or without medication?
No.
Do you have any metabolic conditions such as diabetes?
No.
Okay. Do you have any mental health problems or learning difficulties such as dementia, depression, anxiety?
No. No.
No. Do you have a respiratory disease? This includes chronic obstructive pulmonary disease or asthma.
No.
Okay. Do you have a spinal cord injury?
No.
Have you had a stroke?
No.
Do you have any other medical conditions that have not been listed above?
No.
Okay. All right. And since you answered yes to one or more of the follow-up questions about your medical condition, we need to seek further information before becoming more physically active. We'll just speak to your doctor, your physician, about that online. Okay, Joyce, how old are you?
76.
Okay, and who is your physician?
Dr. Robert Chua.
Okay, and who is your person to contact in case of emergency?
My daughter, Debbie Pirelli.
Okay, and what's her phone number?
812-201-8695.
Okay, and are you taking any medications, supplements, or drugs? Yes.
Yes,
And you have a list with you?
I do, right here.
Okay. Okay, you're taking levothyroxine, toprol, hydrochlorothiazide, Crestor, potassium chloride, and vitamin D3.
Mm-hmm.
And does your physician know you're participating in this exercise program?
Yes.
Describe any physical activity you do somewhat on a daily basis.
Basically just doing some exercises and,
At physical therapy?
right.
Okay.
Mm-hmm.
What kind of exercises do you do there? You do like stretching?
Stretching, resistance, and some bands and walk.
Okay. Do you now have or have you had in the past any history of heart problems, chest pain, or stroke?
Yes,
Any elevated blood pressure?
yes,
Any chronic illness or condition?
no,
Difficulty with physical exercise?
yes,
Advice from physician not to exercise?
no,
A recent surgery in the past 12 months?
yes,
Pregnancy now or within the last 3 months?
no, hope not,
Okay. History of breathing or lung problems?
no,
Muscle, joint, or back or any previous injury still affecting you?
a little, yes,
Okay. Diabetes or any metabolic syndrome?
no,
Thyroid condition?
yes,
Cigarette smoking habit?
nope,
And is your BMI over 30?
yes,
Okay. Elevated blood cholesterol?
no,
History of heart problems in the immediate family?
yes,
Hernia or any condition that may be aggravated by lifting weights or any other physical activity?
no.
Okay. All right. Moving on to the lifestyle questionnaire. Describe your major health, nutrition, or fitness goals.
No, do you want to exercise more frequently?
Okay. What are 2 or 3 biggest barriers to achieving these goals?
No, I don't do it enough time in the day, not enough motivation.
Okay. What are the 2 or 3 greatest strengths that will help you achieve these goals?
That would help if I had someone to go with me and push me a little bit to get motivated and to see some outcome.
Okay, yeah, see the final results. Which would best describe how ready you are to make changes to your lifestyle when it comes to achieving these goals?
Well,
Do not believe I need to change, will make changes soon, would like to intensify changes, would like to change but don't think you can, recently started to make changes in the past 6 months, made changes but relapsed.
I like to try to make changes pretty soon.
Okay. On a scale of 1 to 10, how important is this change to you?
9.
On a scale of 1 to 10, how confident are you that you will achieve these changes?
Oh, a 10.
How would you describe your health? Excellent, good, fair, or poor?
Good.
When was the last time you saw your family physician?
Within the last month.
Okay. Have you ever followed a modified diet to manage a health condition?
No.
Do you follow a specialized diet such as low carb, gluten-free, or vegan?
Nope.
Okay. Are you currently physically active?
Yes.
And do you do any cardiovascular activity a week? And how many days a week would you say you did that?
Maybe 3.
For about how many minutes of the day?
It's about 10 minutes a day.
10? Do you do any strength or resistance training, such as like lifting weights or anything?
No, haven't been doing that for a while.
Okay. Do you do any flexibility training, and how many times a week would you do that?
No, I would try to do it 3 times.
For how long?
15 minutes.
Okay. And what's your favorite physical activity to participate in?
To do a stationary bike.
Okay. What would you like to do with your weight? Lose, maintain, or gain?
Lose.
Lose. What was your lowest weight in the past 5 years?
160 to 65.
Okay. And what was your highest?
Probably 190.
Okay. And what is your current weight?
Around 180.
And what is your height?
About 5'2".
Okay. Do you have any other questions or concerns concerning your health goals?
Being able to become a little more active.
Okay. Now we're moving on to our SMART goals. This stands for specific, measurable, attainable, relevant, and time. So when it comes to your specific short-term goal, what would you like to achieve?
Oh, to start exercising 3 times a week, maybe.
Okay. And how would you measure that?
kind of log in on a journal and on the days that I do it and when the exercises are completed.
Okay. And is this goal attainable for you?
It could be, yes.
Okay. And is it relevant in your life today? Is it something you're really aiming for?
Yes.
Okay. In time, you mentioned you wanted to start exercising for 3 times a week for about 30 minutes each time. Do you have a certain time frame you'd like to do that for?
At least for like 3 months maybe
3 months and then
And
try
then-
to work your way up?
to move on up.
Okay. Moving on to your long-term goals. What's your specific long-term goal?
Well, to lose weight.
To lose weight, okay. And how would you measure that?
Oh, by trying to track the food and how much exercise and keep a log of what I do during the day.
Okay. Would you also try to weigh yourself on a daily basis as well?
Yes.
Okay. And is this goal attainable for you?
Oh, yes. To lose, probably, I'd like to lose around 20 pounds.
20
would
pounds,
help.
okay. And is this relevant to you today? Or
Yeah.
how is it relevant?
It would make me, hopefully, it would make me feel better and feel more like doing things.
Okay. And you said you wanted to lose 20 pounds. What is the time frame for that exactly?
Hopefully, in 6 months, I could try to get that done.
Okay. Probably like 6 to 12 months would. Okay. All right. Well, thank you for participating today.